Welcome and thank you for joining the Society for Clinical Research Sites, or SCRS Talks. I'm Jimmy Bechtel, the Vice President of Site Engagement with the Society. SCRS Talks allows our partners and those that we work closely with to take a few minutes to address issues of industry concern, share exciting achievements, and to learn more about our community. Today, we have Dr. Val Torres, the CEO of Health Data for Good, here to share a little bit of information about what their organization is doing and contributing to solving some of the challenges through data around health equity and diversity in clinical trials. Val, it's great to have you. Thanks for being here with us. I'd love to learn a little bit about you, a little bit about Health Data for Good and your background.
Awesome. Thank you. Good morning. Grateful and blessed to be here. So I'm Dr. Val Torres. I'm the CEO and Chief Partnerships Officer at Health Data for Good. So just a quick background, born and raised in Trinidad and Tobago, graduated from St. Mary's College, Port of Spain, then St. George's University School of Medicine, where I went into med school straight from high school, did my training in Grenada, Miami, New York City, so I've been around. And I got my MBA in multi-sector healthcare management. I had the flexibility to choose what I wanted in life because I graduated with a scholarship, so zero student loan debt. So I left clinical medicine and I went into the business side of things in healthcare. I did some hospital administration, private practice management, and worked in the healthcare industry a bit. I learned a lot about the strengths and weaknesses of the US healthcare system. And I noticed the disparities, the same disparities your organization is tackling right now with minority participation in healthcare. On average, I see primary care physicians seeing about 20 or so patients a day, but in business can influence with policy that can influence millions of lives. So I took the latter in my career, and I bring all of my intellectual and social capital to the table at Health Data for Good with Robert Fletcher, our CTO, who's a chemical engineer, and we're doing some amazing things in US healthcare and globally.
That's great, Val. Thank you for being here. Really excited to have this conversation with you. So continuing that thread, can you tell us a little bit more about Health Data for Good and what you all are doing to support the complex needs of our underserved and underrepresented communities?
Of course. So at its core, Health Data for Good is a resource network that meets the complex healthcare needs of all Americans. We build, maintain, and nurture an ecosystem of healthcare stakeholders that we use to achieve this. And it's a universal rule. People do business with people they like, know, and trust, and we focus heavily on the trust. We have a top-down and bottom-up approach where we build trust and we help those communities. So contrary to popular belief, doctors are not the centers of the healthcare universe. And I'm sorry to say this, but we work with other industries to improve those health outcomes, and that includes nonprofits. So the civil rights organizations, the churches, disease support organizations, advocacy organizations, and all these stakeholders, they historically worked in silos. We break down those silos to get everyone communicating effectively so we can collaborate, cooperate, co-produce, and really get things done. And we do this by leveraging our network to provide Americans with low-cost, no-cost solutions and services that really save lives.
That's excellent, Val. It's a noble and I'm sure difficult, challenging cause, but one that I think is very important to what we're doing to solve some of the diversity, equity, and inclusion challenges related to that. So I want to continue to explore what Health Data for Good is doing to accelerate access to cures and treatments for cancer and other diseases through talking about some of the initiatives or strategies that you all have in place to help achieve that goal.
Oh, that's beautiful. So Health Data for Good is big on partnerships. One of our partnerships is with a health tech company called XCures out of California. And through them, we offer free access to cancer treatment options and clinical trials. We try to make it as simple as possible. So everything is point and click, and the patient has total control of their data. So they make the informed decision when it comes to their health and with the help of their doctor. And we work with a lot of nonprofits So we lend them access to this. They can access that for their members, offer it to the people they serve. Now, all this health data, the patients have control over it, and they're automatically matched to clinical trials and treatments. And all that data that's used, that helpful data is aggregated from third-party sources through XCares partnerships. That's also available to share with patients.
That's wonderful. Val, some of the words that I really hone in on and appreciate you focusing on, things like trust, things like partnership, patient centricity are really key concepts to the work that Health Data for Good is doing. And we talk all the time in SCRS and with our groups that we align ourselves with about how important true partnership and true trust is for patients. And it sounds like you all are really on a path to enable patients to have a better level of trust, better baseline level of trust with the healthcare organization overall and their provider. So I think that's directly addressing and tackling a key issue that we see with representing underserved patient populations in medicine, but also in clinical trials.
Of course.
So again, talking about challenges here, what are some of the challenges or barriers that you all encounter in your effort to support these populations? And I guess take that further and talk about how then you address those challenges.
Man, trust is the biggest challenge. Minorities, the underserved, the under-resourced, they've been neglected for so long that they have little trust in the US healthcare system. That's why it's important to include nonprofits and faith-based organizations in the healthcare conversation. They are the people, they are the boots on the ground that community members trust. So if we want to make a measurable impact, we need to have them, give them a seat at the table for sure.
Absolutely. I couldn't agree more. You're right aligned with some of the things and the principles that we talk about, making sure that those boots on the grounds and those nonprofits, those faith-based organizations understand the value and the need for clinical trials and clinical research and to your point, medicine overall, and how important it is for these populations and how unique they are. And the role that they play in medicine, I think, is such an important piece of the work that we're doing here. I want to go back to that concept of partnership that you've emphasized a couple of times now as being one of the drivers for your organization and the work that you do. So how do you all focus on fostering collaboration amongst your stakeholders? And what role do you play in achieving the mission? And what role does partnership play in achieving the mission of improving health quality and equity?
Oh, for real. So teamwork makes the dreams work. Together, everyone achieves more. And community health really is a team sport. Not only am I CEO, CPO at Health Data for Good, but I'm also co-chapter leader of the Tampa Bay, Florida chapter of the Society of Physician Entrepreneurs. And my team and I are also leaders in the Global Health Impact Network and Funds. We're leading a network expansion effort in the United States, into Latin America, the Caribbean, where there's a lot of work that's needed to reinforce public health infrastructure. We're in 2023, and AI and machine learning, it's big. Those are hot topics. We are leveraging those things to get those other countries up to speed and up to scratch, so they're competitive on a global scale. And we're also working locally with nonprofits and health systems to do the same. Because when one person wins, we all win. We have a whole network of experts that is the Global Health Impact Network working with us. And health is really wealth, right? We also address social determinants of health, being mainly economics. So Americans can really afford to be healthy, right? Healthcare resources come at a cost, and you need to be able to afford these things to make healthy choices and healthy decisions.
It sounds like you all are doing so much in this space and really taking a multifaceted approach to solving some of the challenges here. And again, I can't appreciate and applaud your organization enough for focusing on some of the key issues around trust and building partnerships and what a difference that will make. I also appreciate the different things that you're doing, and there's so much going on, it sounds like, within your organization to solve some of these challenges. So it will be really great to see the continued work that Health Data for Good does to solve what we're seeing as being a major issue with health in diversity, equity, and inclusion.
Of course, of course. I feel like we all have something wonderful to contribute, and we can all bring something valuable to the table.
Well, speaking of contributing, Val, how can other individuals or other organizations get involved in Health Data for Good and continue its mission? Are there any specific opportunities, for engagement that you can highlight that we all can look to support your organization?
Oh, well, frankly, all it takes is a phone call or an email to get started. Just reach out to us. We listen. We make the time for people. After all, it's people over profits. You're welcome to connect with me on LinkedIn or email me at vtorres@healthdataforgood.com. We work well with a lot of nonprofits that would like to offer low-cost, no-cost access to cancer treatment options and access to clinical trials. We also like to work with our global healthcare stakeholders to serve our communities better. As I said, we're working with the Global Health Impact Network to grow healthcare infrastructure locally and internationally. So if that's something that interests you, let's have a conversation. This also includes growing and reinforcing the clinical research ecosystem as well. So you guys are more than welcome to reach out to us and have a conversation. It is a team sport. So a rising tide really does lift all ships, to be honest.
That's exactly right. And I think that's a great sentiment to leave us on here, Val. We need to work together, and there's lots of opportunity for us to do just that as we continue forward with solving these challenges. So, Val, thank you for being here with us. Thank you for sharing what your organization is doing, the important work that you have taken on as an organization, and thanks for sharing some of your insights with us today.
Thank you so much. I really appreciate you making the time to have this conversation.
Absolutely. Absolutely. Thank you again. For everyone listening, make sure that you check out and consider registering for our upcoming summits, where we will be addressing some of these issues as well in a collaborative environment, being held throughout the year by visiting the summit page on our website, myscrs.org. While you're on our website, be sure to also check out the other SCRS publications that we have and that we've created for the community in the publication section of that same website. We appreciate everyone's participation in today's program and look forward to having you join us for more great content coming out very soon. Thanks for listening.